My final presentation is on endometrial carcinoma versus hyperplasia. My patient's history was a 54-year-old African-American female. She had a history of fibroids. She came in for increased vaginal discharge, lower abdominal pain, and abnormal uterine bleeding. She is perimenopausal. Equipment used was a GE Voluson 8 and a curvilinear probe. Endometrial hyperplasia is the most common cause of abnormal uterine bleeding in both premenopausal and postmenopausal women. In premenopausal women, if endometrium measures more than 14 millimeters, hyperplasia is expected. The ideal time to assess for hyperplasia in a premenopausal woman is day 6 through 10 of cycle after bleeding and before the endometrium is stimulated again. In asymptomatic postmenopausal women, 8 millimeters is the upper limits of normal. Women on hormone replacement therapy may have endometrial thickness up to 15 millimeters during estrogen phase, and that's in patients with the sequential hormone therapy. Hyperplasia may occur with persistent anovulatory cycles, PCOS, and obese women. It may also be seen in women with estrogen-producing tumors. Endometrial hyperplasia should be monitored closely, considering endometrial cancer is the most common gynecological malignancy in North America. So we performed a transvaginal ultrasound on this patient. As soon as we put the probe in, we noticed that her endometrium was thickened. It was measuring around 12 millimeters, and it had a very complex, heterogeneous appearance. When we turned color Doppler on, there was flow throughout the endometrium, which is also obviously a concern for malignancy. This was just a 3D of her endometrium in a sagittal plane, and you can see that her endometrium is very thick. This was an anterior fundal fibroid. It measured 1.5 by 1.7 by 1.6 centimeters. It appeared to be touching her endometrium, so this could have also been causing some of her abnormal uterine bleeding, but that also could have been because of the hyperplasia. This fibroid has been seen on previous exams also, and it appears stable, similar to the measurements that we saw before this exam. So, sonographic findings: anteverted uterus, anterior mid lateral fibroid to the right, complex thickened endometrium with increased vascularity. Bilateral ovaries were seen, and they appeared within normal limits for the patient's age. Doctor's opinion: abnormally thickened endometrium for a postmenopausal patient. She recommended a hysteroscopy or a DNC to culture the endometrium, the cells. Patient did not want to have surgery, and we will continue with follow-up ultrasounds and labs to monitor.